Hello everyone, my name is Nina Mirza, and today I will outline an advocacy campaign focused on expanding access to pediatric vision screening globally. This issue directly connects to Sustainable Development Goal 3, which aims to ensure healthy lives and promote well-being for all at all ages. Vision screening in childhood is one of the most overlooked yet highly cost-effective global health interventions. Through this presentation, I will explain the issue, the policy landscape, my specific advocacy ask, and how I would strategically work to influence decision makers. Globally, hundreds of millions of children experience vision impairment, and the majority live in low and middle income countries where access to screening and corrective care is limited. Most childhood vision problems, including refractive errors, can be easily corrected with glasses. However, without early detection, these children may struggle academically, socially, and developmentally. The issue is not the lack of treatment, it is a lack of early identification systems. Research consistently shows that children with uncorrected vision problems perform worse academically and are more likely to fall behind in literacy development. In the long term, untreated vision impairment reduces earning potential and contributes to cycles of poverty. Importantly, pediatric vision screening is extremely cost-effective. A simple screening and corrective lenses can dramatically change a child's life trajectory. The World Health Organization has identified avoidable blindness as a major global health concern, yet pediatric screening systems remain underfunded. Although the Sustainable Development Goals emphasize universal health coverage and preventive care, pediatric vision screening is not consistently mandated at a global level. The WHO's World Report on Vision highlights the importance of integrated eye care, yet implementation depends heavily on national systems. In many countries, screening programs are inconsistent, underfunded, or entirely absent. This policy gap creates significant inequities in child health outcomes. My specific advocacy ask is the allocation of dedicated funding to implement mandatory school-based pediatric vision screening programs within national health strategies. I am advocating for governments and international agencies to integrate vision screening into existing child health and education frameworks. Additionally, I propose measurable implementation benchmarks to ensure accountability and sustainability. To move this campaign forward, I would target policymakers responsible for global health funding and international development programs. This includes U.S. congressional committees overseeing foreign assistance budgets, U.S. aid leadership, and global health divisions within the WHO. Additionally, ministries of health in low and middle income countries are key implementers. Collaboration with established NGOs would strengthen coalition building efforts. My advocacy strategy would include developing a concise, data-driven policy brief tailored to legislators. I would request meetings with staffers and policymakers to present evidence and emphasize cost-effectiveness. Coalition building with global eye health organizations would amplify credibility. Public awareness campaigns using data storytelling and real-world narratives would further build urgency and public support. My Leave Behind document would provide a concise, one-page summary of the issue, highlighting the burden of pediatric vision impairment, its impact on education and economic productivity, and the cost-effectiveness of screening programs. It would clearly outline the funding request and implementation proposal. The purpose of this document is to ensure that after our meeting, policymakers have a tangible reminder of both the problem and the solution. So, in conclusion, expanding pediatric vision screening is a practical, preventive, and scalable global health solution. By identifying vision problems early, we can improve educational outcomes, reduce long-term poverty, and strengthen global health systems. Aligning this advocacy effort with SDG 3 reinforces the importance of prevention and universal health access. This is not only an eye health issue, it is a child development and equity issue. And finally, here are all my references that I've used for this presentation, and I hope you guys all enjoyed listening. Thank you so much.